Back on the record, the time is 5:15.
Good afternoon, Dr. EGILMAN.
Afternoon, Mr. Egdorf.
We've gone about 5 hours of testimony today, and I wanted to, since it's my turn, to cover some things that perhaps we didn't get to talk about just to make sure we fulfill the record, okay?
Yes, sir.
Now, the first thing I know we want to talk about a little bit is just to make clear is, who are you? Who is David EGILMAN? Are you ready to talk to me about that today?
Sure.
The second thing we wanted to talk about was brain injuries and how to prevent them. Is that something you've been prepared to talk about?
Yes, I think I've talked about that today.
And we've talked about that at length. Would you agree with me?
Yes.
Third, warnings. And warnings are very important on these issues. Would you agree?
Yes.
And is that something you're prepared to talk about today?
Yes.
And I believe you discussed some of your experience in warnings with counsel earlier, correct?
Yes.
The fourth thing I wanted to talk to you about is public health. Is that something you're prepared to talk about?
Yes.
And then at least you understand I represent Mrs. Deborah Pletz and the estate of Greg Pletz. Is that right?
Yes.
So you understand one of the things that's important to me that I'd like you to talk about today is, could Greg Pletz's death have been prevented? And is that something you're prepared to talk about?
Yes.
So why don't we go back to number one, Doctor. Can you just introduce yourself to the jury and tell them a little bit about yourself?
Sure. I've got a lovely wife, Helene, and two great kids, Sam and Alex. Sam teaches kindergarten. Alex is at Yale doing research on openness in court proceedings related to health.
And before we talk a little bit more about that, you were asked some questions earlier today about whether your kids played football. You remember that?
Yes.
And I'm sorry, I don't recall the exact testimony. Which of your children has played football?
Alex.
And how many years ago would that have been that Alex played football?
12, 13.
So 2005, give or take.
Right.
Have you learned things in this case that you didn't know about when it comes to concussions and head trauma that you didn't know about back then in 2005?
Yes.
Have you learned, have the things you've learned in this case, would they have mattered to you if you had known them back in 2005?
Absolutely.
Would those matters have impacted your decision making as to whether or not you would have let Alex play football?
Objection form.
Yes, and his decision making, since he was probably old enough to have participated in that decision making at that time, had he been given the information.
Objection non-responsive.
Do you wish that you had some of the information that you've learned in this case when you were deciding whether or not your son could play football?
Yes.
Have you read Dr. Hainline's deposition?
Yes.
Do you recall that I asked Dr. Hainline some questions about whether or not he believed the NCAA was the leader when it came to youth football and youth football following their lead? Do you recall that?
Yes.
Hey, hang on. I don't mean to interrupt. If you can give me just a slight pause to get the objection form in, because I don't want to talk over him at the same time.
I'll give you a running objection to form to every question.
Well, I don't want to have to object to every one of them.
Well, I'm not saying you have to. You get the right later to say if you objected or not.
Well, if I can get a pause, or if we can agree, I can say objection form after his.
I'm giving you something better than that. You don't have to say anything. You get to have a record that says you've objected to every question if you want to. You don't have to pause. He doesn't have to pause. You don't have to worry about if you missed it.
I prefer to just object on the record.
So you say you don't want to obstruct, so you're going to take the strategy of obstructing.
I'm not obstructing. I'm just.
Then why wouldn't you agree to what I proposed?
Because that's not required by the rules.
Yeah, so you can obstruct. All right. Doctor, with what you know today, would you have allowed your son Alex to play football?
No.
Would you have allowed Sam to play football?
No, he didn't play football.
Well, if he asked.
No.
If a patient, a friend, a family member came to you today and said, "Doctor, is it safe for me to play football?" How would you respond to that?
Objection form.
Well, the short answer would be no, and then I would explain to them what I've learned from reading the NCAA secret documents and some of the medical literature that's been published since 2005 or 6, in addition to what I knew before.
Objection, no response.
And that kind of information and what you said you would do, does that fit in how you define the term warnings as you said you were prepared to talk today?
Yes, that would be part of warnings.
One aspect of warnings being disclosure, is that what you're saying?
Yes.
Okay. Let's go back to some of your training and education. A little bit of that got asked about, but I wanted to make sure we get the record full and clear on that. Where'd you go to college?
I went to Brown University.
Right here in Providence?
Yes, sir.
Did you obtain a degree?
I did.
And what was that in?
Bachelor of Science with a concentration in molecular biology.
And what did you do after that?
Then I was a VISTA volunteer, Volunteers in Service to America, with the Providence Neighborhood Health Centers here in Providence.
All right, and what is it you were doing as a volunteer generally?
Well, VISTA was the kind of the domestic Peace Corps. Stands for Volunteers in Service to America. There's a couple of analogous programs now, like Teach for America, etc. And what I was doing was helping increase the awareness in generally in minority communities and immigrant communities in Providence about the services that were available. I also did a project on problem-based records, trying to convert the providers to what's called a SOAP system, S-O-A-P, how you do your notes so that they can be better organized and used.
And after you completed that volunteer service, did you go back to school?
Yes.
What did you do then?
I returned to medical school at Brown and got a medical degree in 1978.
And doctor, just for clarity, what year did you receive your BS?
1974.
And counsel asked you some questions about what your medical degree was in, what was your specialty, and that sort of thing. Can you just tell the ladies and gentlemen of the jury generally the types of subjects you studied while you were in medical school?
Objection form.
Well, we did anatomy, physiology. Related to this case, we would have studied neurology, brain function, and dysfunction, all the brain-related diseases, particularly Alzheimer's. The dean here at the time was a neuropathologist, Stan Aronson, and he did a lot of work. I did work with him, and he did a lot of work on neuropathology. So those are the kinds of topics related to this, and then we did, everything else that you do, physiology, all the body organs besides the brain, peripheral and peripheral neurologic system.
Now, as I understand it, there's more to becoming a doctor than just going to medical school, fair?
That's correct.
What did you have to do following medical school so that you could actually be referred to as a doctor and practice medicine?
You got to pass some tests, and then you have to do a residency in any of a variety of fields. I did a residency in internal medicine.
And we had a little bit of discussion this morning about some of your experience in internal medicine, but just so we're clear, can you define that area of expertise for the jury?
Sure. Internal medicine is diseases of adults, and so it's everything from runny noses to Alzheimer's disease or CTE, heart attacks, other things. It's the first contact point. So when a person gets sick, they generally see a family physician or an internist initially. That is adults.
So you might, hypothetically, if someone like Greg Pletz could have come to you when they were first having symptoms, going to an internal medicine doctor first and saying, what's going on with me? Is that the kind of patient you would see?
That's correct.
Objection form, objection leading.
Have
In some cases, Now with insurance, you generally have to go see a primary care person, internist, family physician, nurse practitioner before you can see a specialist if you require specialty care. So that's kind of how the system's designed.
Let me ask you a couple of questions just because of the objection that was raised. As an internal medicine doctor, are you a primary care physician?
Yes,
And you practiced as a primary care physician?
yes,
Did you have experience with patients coming to see you where they or their loved ones were having problems with dementia or memory or symptoms such as that?
yes,
And you tried to treat those patients?
yes,
Also, I assume, provided recommendations for consultations, neurologists, things like that.
Objection leading.
Is that fair?
yes.
All right. After you did your residency, I don't know if we cleared up exactly where that was. Can you tell me that, please?
The residency was at the University of Rochester in Rochester, New York. The first residency,
Yeah, did you do more than one doctor?
yes.
Where was your second one?
The second one was combined with the National Institute of Health Epidemiology Training Program and the National Institute for Occupational Safety and Health. So I got a master's in public health at Harvard, and then I did 2 years of doing epidemiologic studies and studying epidemiology and also taking lectures and otherwise participating in activities that would allow me to get board certified in occupational and environmental health.
All right, so several things that you've referenced there that I'd like to go back to if we can. First of all, you referenced NIH and NIOSH. Can you explain to the ladies and gentlemen of the jury what those organizations are?
Sure, the National Institutes of Health was set up in the late 40s and it's got a variety of institutes that deal with a variety of diseases. Is generally divided by organ system. So there's a heart institute, there's a lung institute, there's a neurology institute there. And they do research on diseases, and they also treat patients. They have hospitals affiliated. They have a hospital affiliated with the institutes. It's in Bethesda, Maryland.
Now, you also testified that you received a master's in public health from Harvard. Can you tell me what year that was, please?
That was in 1982.
And I had the sense from your testimony this morning that public health is kind of a passion of yours. Can you define for us what public health is?
Well, there's two parts of public health. The first part of public health is figuring out what makes people sick or what makes people well. And by that I mean, for example, broccoli may reduce your risk of lung cancer, as a hypothetical. So public health would try to figure out the things you should do to stay healthy and the things you should avoid that might make you sick. That's part one of public health. Part two of public health is taking that knowledge and implementing it in the population. So you try to get people, for example, to stop smoking, or in this case, to not get concussions from repetitive head trauma from football. So once you know that repetitive head trauma causes concussions, then you try to figure out how you can stop that so you can prevent concussions and then eventually CTE from occurring.
Objection unresponsive.
Do you believe there's a public health aspect to this concussion issue we've been talking about today?
Oh, yes.
Can you explain that, at least just generally, for the ladies and gentlemen of the jury? I know you touched on it some, but just so we have a clear question and answer on that.
Sure.
Objection form.
The only way to prevent, this is actually a perfect example. Many things are not treatable. Many diseases are not treatable. So the only thing we can do in medicine and public health is stop them from occurring in the first place. And CTE is not treatable. Dementia is, for all intents and purposes, not treatable. All we can do is try to prevent them from occurring. That makes it squarely a public health problem in terms of eliminating or reducing the disease burden in the population. And we know a lot about what causes those things to happen. So public health takes the information about cause and implements programs to educate people about and develop interventions. That would be, for example, in this sense, rules about how to prevent them from occurring in the first place.
Objection on
You also talked to us a little bit about, or mentioned that you spent 2 years involved in epidemiology. Can you talk to me a little bit, and to the jury a little bit about that study and the expertise you gained in that area, please?
No, I was in a 3-year program with the National Institutes of Health called the Epidemiology Training Program. The first year was getting a master's in public health, so I took coursework in statistics, epidemiology, and a variety of other warnings, risk communication, a variety of other issues. And then I did 2 years of practicum work, designing and implementing small and large epidemiologic studies. Epidemiologic study is a study of groups of people to determine what might be making them sick or what might be making them healthy.
Doctor, do you consider yourself to be an expert in the field of warnings?
Yes.
Have you seen any evidence in this case and all these documents and studies and things you brought today to indicate that Greg Pletz was given any warning that he was at a risk of death or brain damage from playing college football?
Objection form.
No. And can we just take 1 second,
Yes, sir.
Tess?
Going off,
Hey, you go off for just one second.
going off the record, the time is 5:32.